All right, so thanks so much for doing this, Lauren. My first question that I have for you is tell the audience a little bit about yourself and how you started in the community.
Hi, Laszlo. Thank you so much for having me. So, my name is Lauren Nelson. I'm the owner and founder of Sage Integrative Healing. How I got started in this community in Seattle, Washington, I moved here actually about 6 years ago now, but I've actually been in the field, the healing field, psychotherapy to start out with for about 18 years. Yeah, I started out as a traditional psychotherapist, but quickly realize that healing doesn't happen within four walls, right? And so I have expanded my practice to include a lot more holistic modalities, mind body practices to really get to the core of deep healing for my clients and support them in being their most optimal selves.
hmm So tell me a little bit about the work that you do in your current role. What's that like?
Yeah, so I combine various different psychotherapy techniques with coaching, applied kinesiology techniques like neuro-emotional technique, and then dance movement therapy. I work with individuals, couples, families, and groups. I also do consulting work. I do a lot of work with systems theory, and just helping organizations with reorganizing things as well.
If you could talk a little bit about those modalities, I think those modalities that you mentioned are so new to me. So if you could talk a little bit about that for those who don't know.
Sure, sure. So the psychotherapy models, practices. So I mean, it's my life's work, right, to support people in their healing journey. And so I studied all different types of psychotherapy models. So psychodynamic, Gestalt therapy, CBT, DBT, internal family systems theory, family therapy, couples therapy, sex therapy, but then just segued into more integrative techniques. I am an integrative medicine for mental health practitioner, because a lot of mental health issues are actually underlying, there's an underlying physical component. So I became fascinated with that. I then also studied neuroscience and the nervous system. So mainly my practice now is just like applied kinesiology techniques. And just for the sake of this interview, I'll just focus on one. So neuro-emotional technique. And so neuro-emotional technique is really interesting because it works with the unconscious mind. So when you're sitting there in psychotherapy, you're really working with just the conscious mind. So that's like 12% of the brain. But what's really driving behavior, feelings is the unconscious mind. So neuro-emotional technique actually um, gets to the unconscious mind. And so we do that with applied kinesiology. So a manual muscle test, like when you go to a doctor and they like tap on your knee or they tap on your elbow, it's like a reflex. So the same thing can be used to access the nervous system. And so I found that using techniques like neuroemotional technique, I could access the nervous system and I could create lasting change for people in a very short amount of time. So essentially in a session, I am taking somebody's nervous system from like a fight or flight to a rest and digest, right? And so pretty fascinating. It works with neuropeptides in the body. So when when we experience a stressful event or trauma, we form what's called a neuropeptide. So that's basically a information substance in your body. It's made up of hormones. Uh, it's a molecules like, and it forms in your nervous system so that when there is a similar stressful event that happens, the body just kind of stays in this cycle of fight or flight, right? And that could be a physical trauma or emotional trauma or just something you're stressed about, right? The body forms a neuropeptide. So essentially, what NET does, neuroemotional technique, is it goes in, it binds the neuropeptide, and it releases it. So this brings the body back to homeostasis, and you can kind of move forward in your life and in relationships without that feeling of being triggered.
hmm but how do you sort of use that technique with your patients? So, like, when people come in and visit your sessions, how do you sort of apply that to neuroemotional technique to, when you're working with clients?
Yeah, so I'm not really sure I understand the question, but I that is how I work with clients. They'll come in for a session and we just start like a lot of people seek me out specifically for NET, and there's lots of videos and things online. So they'll come in and they'll say, I want to do NET or these applied kinesiology techniques. I think there's something, in my nervous system that's blocking me, right? And so I will just bring them in and we'll start with an NET session. An NET session starts with a muscle test. So applied kinesiology is, it's a type of muscle testing, right? So we just start with the muscle test and see kind of what the body and the nervous system is presenting with, and then we just kind of go from there. Does that make sense?
Yeah, it does. What has the response been like from your patients, when they work with you, how have they felt when they've come see you and then, you do this technique? So like what has the response been like basically?
Yeah, it's a great question. So the response has been really positive. So um, really, my practice has shifted mostly to NET and these applied kinesiology techniques because it's so effective. But yeah, people come to me after coming to multiple different doctors, multiple different practitioners. They're really stuck, and so yeah, I mean, they're amazed that their nervous system can be relaxed after just one session, and trauma can be released so quickly. So the response is extremely positive. I mean, people feel different just after one session, in their mind and their body. It's a different feeling that they're really not used to having. Yeah.
Hmm. My last question to kind of wrap this up is like how can people in the psychological realm, how can they sort of use this technique to really work with patients with a variety of issues? Because t- just learning about this, it's all new to me. So
Mm.
what advice would you give to people who are coming into the psychological um mental health realm, I should say?
Sure. Now, is this question for, people who want to be practitioners, or is this people who are just entering, like who want to do this work?
Um, yeah, a little bit of both. Yeah, sorry.
Okay. Yeah. No, no, that's a great question. So, yeah, I mean, practitioners I mean, as practitioners, we seek out all different types of modalities to practice to really support our clients. So, people can get trained in this, certified. Only licensed practitioners can be trained in NET, which is great. So you're getting somebody who's highly trained, right? Highly skilled. And then, people who want to just have a session with this, I mean, you can look up NET, right, on the website. And I mean, there really are lots of different practitioners who do various types of applied kinesiology techniques to work on the nervous system. So, I mean, I would say that it's definitely worth a try if you have been in psychotherapy for quite some time, or other different modalities would just use the conscious mind. I would say, really, yeah, to seek out this other modality, because it does really help. Yeah.
Hmm.
I'm
All
not sure if
right.
that answered your question.
It does. Yeah, it pretty much did. All right.